Hello, my name is Dr. Robert Wong from Stanford University School of Medicine and VA Palo Alto Healthcare System. Today, I will present this paper recently published from our team describing the prevalence of hepatitis B virus and latent tuberculosis co-infection and risk of drug-induced liver injury across two large hepatitis B cohorts in the US. I will be presenting on behalf of our team of collaborators listed below. Some background information. Little data exists on the prevalence of hepatitis B and TB co-infection. Our team recently conducted a systematic review and meta-analyses to try and better define the epidemiology of hep B TB co-infection. In this paper published in 2022, as you can see, we performed a systematic review and meta-analyses, started with initially 1,205 articles identified, and after applying inclusion-exclusion criteria to specifically evaluate the prevalence of TB co-infection in patients with underlying chronic hepatitis B, our final cohort included 6 studies that provided data to describe and estimate the prevalence of latent TB among patients with chronic hepatitis B. As you can see here in our table figure, among these 6 studies that were included, on meta-analyses, the combined pooled prevalence of latent TB was about 34.25%, which is much higher than what has been expected. You can see here there was a broad range of prevalence and significant heterogeneity existed in these studies. It also highlighted the paucity of data and lack of high recent as well as large population-based studies to really understand the prevalence of latent TB co-infection in patients with chronic hepatitis B. To build off of this study and understanding the lack of data to understand co-infection, we performed a large US-based study utilizing a national laboratory-based data set. And this was a paper published last 2022. You can see here in total, we had about 89,000 individuals with chronic hepatitis B identified. And just drawing your eyes to the first line, which represents the total population. First, we looked at the proportion of patients that were tested for TB across different time periods, within 3 months, within 6 months, within 1 year. And then just looking at the final column under testing, ever during study period. That means among the 89,000 chronic hepatitis B patients we identified in the US, only 10.7% were ever tested for TB. Among those that were tested, what was the co-infection? So you can see here in this column titled Latent TB Infection Co-infection in chronic hepatitis B patients. So among those tested, the prevalence was 19.6%. We compared that with the general population without hepatitis B, and you can see here on the second to last column that it was 7.3%. So what this tells us is that among chronic hepatitis B patients in the US, only about 1 in 10 were tested for latent TB. Among those tested, the prevalence was almost 20%, which is more than, I would say, actually almost 3 times higher than the general population without chronic hepatitis B. And when we stratify by different demographics, whether it's gender, age, or race, ethnicity, we saw very similar patterns. Low rates of testing. Among those that were tested, the prevalence of TB, hepatitis B co-infection was high and much higher than the general population, which really emphasizes that these are high-risk populations, and likely both TB and hepatitis B have similar risk factors, especially country of origin or other risk factors that prompt investigation of both of these disease states. And really, these data highlight the importance of thinking about testing for TB among all of your hepatitis B patients, not only to understand co-infection status, but it may impact treatment decisions. For example, patients with latent TB who have underlying hepatitis B may be at higher risk of drug-induced liver injury for certain anti-TB therapies and may require optimizing management to use drugs with less risk of hepatotoxicity. So building off of that, we performed in the US a retrospective cohort study of 2 large US cohorts of adults with chronic hepatitis B. The CHECS cohort, which many are familiar with, is an established longitudinal cohort of patients with hepatitis B and hep C. And we also evaluated a national VA cohort of hepatitis B patients. Among those with hepatitis B, in parallel, separately for each cohort, we evaluated the proportion of patients that receive TB testing of any sort, which includes the lab testing methods listed here. And among those who were tested, we evaluated the proportion of hep B patients that were co-infected. We also were able to look at medication data to determine the proportion of patients who received treatment and evaluated the incidence of drug-induced liver injury. Table 1 illustrated here represents our cohort. You can see here are 2 parallel cohorts. The VA Hep B cohort had almost 13,000 patients with chronic hepatitis B, and the CHECS cohort had over 6,000 patients with chronic hepatitis B. You can see the demographics, the gender distribution, the race ethnicity distribution, as well as the age, HIV status, hep C status, country of origin, country of birth was a variable that we could evaluate in the VA cohort, but not in the CHECS cohort, and then the prevalence of cirrhosis in the different populations. This figure in table below highlights the main take-home messages. As you can see here, we stratified by both different cohorts. Looking first at the first set of figures, the VA Hep B cohort, we had nearly 13,000 patients with chronic hepatitis B. Only about 14.7% had testing for TB. Among those that were tested, the prevalence of hep B TB co-infection or latent TB co-infection was 14.5%. Of these co-infected patients, only 18.6% had prescribed treatment for the TB. And among those, 3.9%, or 2 patients out of 51, developed drug-induced liver injury. In the CHECS cohort, interestingly, we had about over 6,000 chronic hepatitis B patients. Only 9.1% had TB testing during the study period. Among those that were tested, the prevalence of hep B latent TB co-infection was 7.7%. And you can see here in this cohort, similar to the VA cohort, only 16.7%, or 7 out of 42, were treated for latent TB. The development of drug-induced liver injury was 2 out of 7, so 28.6%. But looking at the numbers, it's only 2 out of 7 compared to 2 out of 51 for the VA Hep B cohort. So again, similar to the previous studies that we highlighted, this data in 2 longitudinal US cohorts highlights the low rates of testing for latent TB among patients with chronic hepatitis B. Among those that were tested, there was a sizable prevalence of co-infection. This potentially, although we were not able to evaluate this specifically, but potentially the co-infection status may have led to hesitancy to start anti-TB therapy. As you can see here, among both cohorts, less than 20% were treated. And among those that were treated, the range of drug-induced liver injury did range from about 4 to 28%, although the sample size was low among that analysis, and thus you can see the confidence intervals were quite wide. So take-home points from this recently published paper. In summary, among 2 large and unique US cohorts of adults with chronic hepatitis B, we observed low rates of TB testing but among those who were tested, Hep B latent TB co-infection was found as many as 1 in 7 chronic hepatitis B patients. Even more concerning among patients with hepatitis B latent TB co-infection, only 16 to 19% of patients were treated, which may reflect potential delays, gaps, and hesitancy in treating co-infected patients in a timely manner for their latent TB. While there is a risk for drug-induced liver injury in patients with chronic hepatitis B treated with anti-TB therapies, modification of TB regimens and early initiation of chronic Hep B antiviral therapy has been associated in studies with significant reductions in this risk, and thus clinicians should not delay timely treatment of latent TB. Thank you for your attention.